So when we talk about partnerships, indeed, we're talking at the high level. We're talking governments, CSOs, NGOs. But it's important to understand that those partnerships are only valuable when we know what the story on the ground is.
We've been clear from the starting about what Africa needs. We need to save lives, we need technology from the Nordics, and the Nordics are ranked top countries when it comes to innovation and technology.
More than 100 champions and leaders in women's health gathered here today to make the statement together that women's health will not be ignored. We're here to advance the health for women so that we can have equal rights.
Partnerships needs that we have to be equal partners and move out of the old aid paradigm and to make sure that we see our similarities but also the challenges, of course. And I see that a lot of actors together can work.
There is all the more need for collaboration between all the players, the governments, the private sector, the researchers, foundations or the donors to really address these critical issues.
We need to scale what already works, so we need to reach many more and we need to do it smarter. And here technology can really make a difference in terms of, in a very cost-effective way, reach and support those midwives that are otherwise difficult to reach with hands-on practical guidance as an integrated way of their day-to-day work.
There's also a need for that external financing to accelerate results faster than usual, so enabling these countries to make the best possible use of, on the one hand, available innovations, but also their own domestic resources to be allocated in the most efficient way to achieve the outcomes that they want and we all want to support them to achieve.
Private sector often plays the role of a catalyst when it comes to collaborations, both within low and middle income countries, and we're thinking about how to find sustainable solutions to partner.
And this has to start with us policymakers making the right policies, making the right guidelines, and most importantly, making sure that they are implementable and they are reaching down at primary healthcare level where they're needed.
Public-private partnership is mandatory. We know now we are going to collaborate more so that we can meet the SDGs goals.
They need to respect the environments, the values, and the knowledge that actually exists with the communities, so that when we build primary health care for better maternal outcomes and for more maternal health, we build them bottom up.
What I hope to is to tell real stories about what mothers faces in different parts of the world, and I feel very hopeful. There are so many people here that can actually implement these changes.
We've launched a platform here in Stockholm and we're seeing backing of this platform. So we now want to build on what we've created towards the next summit in Africa to really make sure that those connections we're facilitating now and those conversations are nurtured from regions that realize we need new allies and we need to build stronger partnerships to make health work for all. So that's why we see the Nordic region and African partners as really, really good allies in building stronger health systems together.